Welcome to the Shiley Flexible Tracheostomy In-Service Training. After this training, you should understand differences between the legacy Shiley tracheostomy tubes and the Shiley Flexible Tracheostomy tubes, and what these enhancements mean for your patients. Size and skew identification, specifically how to identify the size of your patient's tube and how to cross a legacy Shiley tube to a Shiley Flexible tube. Recommendations for cleaning your Shiley Flexible tubes and inner cannulas, both disposable and reusable. And tips and guidance to share with patients going home on a Shiley Flexible tracheostomy tube. Legacy Shiley versus Shiley Flexible tubes. What's the difference and what does it mean for your patients? From the first tube in through the time the patient is discharged, Shiley Flexible tubes incorporate several clinical enhancements designed for all stages of the care continuum. The clear flange was designed with enhanced wound care capabilities in mind. The new design allows for enhanced visualization of the underlying skin and stoma site. The recess on the backside of the flange and the additional air vents allow for reduced skin contact and better airflow around the stoma site. Shiley Flexible tracheostomy tubes include increased safety with a taper-shaped cuff that uses lower intercuff pressures to provide a more effective air and fluid seal. Additionally, the cuff is thinner and less bulky, which requires less force to insert. When the cuff is deflated, patients may experience a significant increase in airflow around the outer cannula, which may reduce the work of breathing required to speak and wean. All of the models in the Shiley Flexible tracheostomy line come standard with a tapered percutaneous tip. This feature aids in bedside insertion should it be preferred over a surgical procedure. The Shiley Flexible flange features a built-in 15mm hub connector. This feature expands options for ventilating the patient without requiring an inner cannula to be in place. As a safety precaution, the inner cannula should always be in place when using a dual cannula tracheostomy tube. In the event of an occlusion, you can simply remove the inner cannula and clear the occlusion, rather than removing and replacing the whole device. The Shiley Flexible inner cannulas snap into the integrated connector. The Shiley Flexible tubes are manufactured with a soft material that uses a citrate-based non-phthalate plasticizer. This change in material removes the DEHP chemical and allows for a softer feel than the legacy products. The outer cannula is flexible enough to conform to the patient's airway, but rigid enough to maintain airway patency. Sizing and skew identification. How to identify the patient's trach size. For easy identification, inner and outer diameter measurements appear on the upper and lower edges of the flange. The product code can also be found printed on the flange under the REF or reference box. The disposable Shiley Flexible line incorporates a color-coded feature that helps you quickly identify the correct inner cannula for the corresponding tube. Simply match the color on the front of the flange with the color on the outer box containing the replacement inner cannulas. Shiley Flexible tubes are not compatible with legacy Shiley disposable inner cannulas. You should only use a Shiley Flexible inner cannula with a Shiley Flexible tube. Additional disposable inner cannulas for Shiley Flexible tubes may be purchased separately in boxes of 10. Shiley Flexible adult tubes follow ISO sizing and are available in an expanded selection of sizes. The first number is the Jackson size. The first letters indicate a cuffed tube, CN, or an uncuffed tube, UN. The second numbers indicate the ISO size, or the inner diameter of the outer cannula. The last letter indicates whether the inner cannula is disposable, H, or reusable, R. Sizing and skew identification. How to cross a legacy Shiley tube to a Shiley Flexible tube. Shiley Flexible tracheostomy tubes follow both Jackson and ISO sizing to make crossing from one tube or brand to the other as seamless as possible. If you are crossing a legacy Shiley tube to a Shiley Flexible tube, look at the first number on the legacy product SKU, and then match that to the leading number on the Shiley Flexible product SKU to find your cross. For example, a 6DCT would cross to a 6CN75H. When crossing a legacy Shiley tube using Jackson sizing to a Shiley Flexible tube, the outer diameter is the same. This will always be the case for Shiley Legacy to Shiley Flexible tube crosses. To cross a tracheostomy tube using ISO sizing, you will want to look at the second set of numbers. For example, if you need a cuffed tracheostomy tube with an ISO size of 7.5 millimeters, you would cross to a Shiley Flexible tube size 6CN75H. We offer printed versions of this information for all of our customers. Please let your sales representative know if you would like a copy. Shiley Flexible Care Overview: Disposable and Reusable Inner Cannulas. Each Shiley Adult Flexible Tracheostomy Box with disposable inner cannula includes a tracheostomy tube with an inner cannula and a blue obturator. The obturator is used during initial placement of the tracheostomy tube. It helps ensure the cannula remains patent as it is being inserted. The disposable product line features an inner cannula that is removed and replaced with the new inner cannula twice daily or based on the patient's needs. The inner cannulas used in the disposable line are not approved for reprocessing and have not been tested for long-term use. They are identified by a "Do Not Clean" label etched on the body of the inner cannula. Additional inner cannulas can be purchased separately in boxes of 10. Each Shiley Flexible Adult Trach Tube box with reusable inner cannula includes a tracheostomy tube with 2 reusable inner cannulas. Every box containing a Shiley Flexible tracheostomy tube also includes tool ties to secure the tube at the patient's neck. Alternately, a trach tube holder can be used to secure the tracheostomy tube. The package also includes a blue obturator, which is used during initial placement of the tracheostomy tube. The obturator helps ensure the cannula remains patent as it is being inserted. The reusable inner cannula should be cleaned once daily or as needed. 2 inner cannulas are provided so that one is always clean and ready for use should the other become occluded or be in the cleaning process. The Shiley Flexible Reusable product line offers 2 reusable inner cannulas. The inner cannulas are cleaned daily and reused for the life of the tracheostomy tube they come with. It is important to note that there are no replacements or supplemental inner cannulas for the reusable tracheostomy line. Should the reusable inner cannulas be lost or thrown away, a replacement inner cannula would have to be taken from a new, identical tracheostomy tube box, or the entire tracheostomy tube would have to be replaced. For guidance on cleaning the tracheostomy tubes, please refer to the Product IFUs or AACN guidelines. Shiley Flexible Adult Tracheostomy Tubes may not be reprocessed for multi-patient use. Shiley tracheostomy tubes may be used for up to 29 days. Homebound patients using Shiley Flexible tubes. For the safety of each patient going home with a Shiley Flexible tube, it is important to remind them that Shiley Flexible tracheostomy tubes are not compatible with legacy Shiley inner cannulas or inner cannulas produced by other manufacturers. Patients must use a Shiley Flexible inner cannula for their Shiley Flexible tracheostomy tube. All Shiley tracheostomy products come with an instructions for use document which outlines detailed recommendations for cleaning the tube, inner cannula, and all other components included with the trach tube. Home care guides and video resources for your patients and caregivers may be found online at the following link. Or you may contact your Shiley representative to request a printed version of any of these resources. Additional patient and caregiver resources can also be found online at livingwithevent.com.